Well, I'm going to talk about interventional oncology, and interventional oncology is basically using the same techniques we use for interventional radiology and interventional endoscopy, but used in a cancer setting. So one of the problems with our management of cancer in veterinary medicine is, like human medicine, if we could surgically remove a tumor and cure the patient, then we'll opt to do that. But in veterinary medicine, we know we diagnose tumors at a much later stage, and our medical oncology, the use of chemotherapy, we do dose reduction so we don't have the same side effects that they see in people, because most clients don't want to see their patients go or their animals go through any complications. So we have a lot lower response with our chemotherapeutic drugs. So what we can do is we could use interventional radiology techniques to treat cancer patients. And one way we can do that is if we have a tumor obstructing a ureter or a urethra, we could put a stent in to open it up and relieve the urinary obstruction, or a tumor in the trachea, we could open up the trachea. We can put stents in blood vessels when tumors are obstructing them. Or the other thing we can do a lot of is instead of delivering chemotherapy intravenously, that goes back to the heart, getting diluted with all the blood going back to the heart, then going to the lungs, the first capillary bed, then back to the heart, and going throughout the body to the bladder tumor, for instance, or the prostate tumor or the liver tumor. What we can do is take a catheter under fluoroscopic guidance, put it in the artery in the leg, and under fluoro we could bring that catheter up to the hepatic artery going to the liver, we could bring it to the prostatic artery going to the prostate, we could bring it to the maxillary artery going to the nose, and we can infuse the systemic dose of chemotherapy directly into the tumor. And that's what we're doing back here. This is a dog with a non-resectable liver tumor, and we bring a catheter directly into the tumor and give the systemic dose of chemotherapy. We get 20 to 50 times the concentration of chemo directly into the tumor, and then we can inject little particles to take the blood supply away. And we can do that in areas all over the body to improve our dwell times with chemotherapy, the concentrations, and reduce the systemic side effects that we get, so we could avoid some of the problems with bone marrow suppression and GI upset. So that's what we're examining now, is using the interventional radiology techniques to palliate a lot of animals with cancer where traditional therapies have failed or are not indicated or may be associated with excessive morbidity.